Hello again. So today this video is going to be to discuss something called trigeminal neuralgia. I actually have trigeminal neuralgia on both sides of my face, but first, before we get into that and my experience with it, let's talk a little bit about what the trigeminal nerve is. You actually have two trigeminal nerves that come out of the base of your skull. It is the fifth of the 12 cranial nerves that you have. And there are actually 3 different branches to each trigeminal nerve that comes out of the base of your skull. The trigeminal nerves supply different parts of the head, the scalp, the forehead, even eyelids, cheeks, mandible, and maxilla area. So it's classified into 3 different branches, and those branches are V1, V2, and V3. V1, I believe, is considered the ophthalmic branch. V2 is the maxillary branch, and V3 is the mandibular branch, which means your jaw area. So as you can see, the trigeminal nerve controls a lot of the nerve sensation and functions of your face, head. It can even do sensation with the ears and things like that. They actually call trigeminal neuralgia the suicide disease. I do not care for that term because it sounds so negative, but that's what they call it. That's just another term for it, and the reason that it is known as that is because of the amount of pain that it actually causes. It is not pleasant. The best way I know to describe it is it's like a shock-like ice pick pain. It feels like someone is like taking a taser almost to your different parts of your face, depending on what irritates it. It can cause your eyes to close. I actually also have something called hemifacial spasm on this side. My trigeminal neuralgia is much worse on this side than it is this side, but again, I have it on both. Woohoo! I really would not wish this disorder on anyone, like absolutely anyone. Those of you that have it, you're well aware of the amount of pain and discomfort that it can cause and how hard it is to manage. But before we get into the treatment options and the possibilities of management, I will share with you my experience as far as why I have trigeminal neuralgia myself. So part of it is due to the fact that I have a Chiari brain malformation. In my first video, I touched base on what a Chiari brain malformation is. And what it is, again, just to kind of reiterate, is when your brain, you have a little hole back here called your posterior fossa where your spinal cord comes out. And if you don't know what that is, you can actually kind of feel it back there. But in Chiari brain malformation, your brain actually protrudes through. So it just, like the hole, it just kind of protrudes through your posterior fossa, that hole back here. And they call it a herniation, tonsillar herniation. Mine, again, is measured at 10 millimeters. Herniation does not negate what symptoms you do or don't have. But back to trigeminal neuralgia. So Chiari malformation in and of itself can actually be a cause of trigeminal neuralgia. So that's one reason that I have this disorder. The second is kind of brain farting a little bit, but it's okay. Let me get back on track. I have trigeminal cysts on my mandible, your mandible being your jaw. I have 2 bilaterally, meaning on each side, and I can actually feel them now. I've had them all my life. Didn't know that that's what they were. MRI confirmed that. I've had quite a few brain MRIs, quite a few MRIs all over my body, to be honest, all before I found out I had Ehlers-Danlos syndrome. So the Chiari malformation is the cause of mine. The trigeminal cyst down here, I did always have more trouble in this area prior with like nerve pain. I didn't know exactly what was going on when it first started. I would just randomly get just shock-like pains going through my jaw. It had not moved to my ophthalmic branch, the V1. It was in mostly the maxillary branch and the mandible branch. And I hold this side because this side is very much worse for me, like a ton worse. Again, I do have it on this side. So what really pushed things over the edge as far as the pain and starting the shock-like pretty much everywhere, the scalp, is I actually had a bilateral occipital nerve block ordered by a neurologist, a legitimate, at least so I thought, neurologist. And it is something that I regret having done. This is just me being absolutely, totally transparent. I completely regret having that done. It left me with permanent nerve damage. It actually left me with a brain injury also. I'll explain how in a little bit, but it left me with permanent nerve damage to not only my trigeminal nerve, but also something called my glossopharyngeal nerve. And what that is the glossopharyngeal nerve. It's actually like the inside of your mouth. So it's the back of your tongue, your palate, which is like the roof of your mouth, and just basically the whole back inside of my mouth, teeth. So it damaged that also. It damaged a lot of my sensory and cranial nerves. So it's not really something I enjoy talking about, but I'm getting more comfortable talking about it. I do have to take medication for it now. It only barely, I don't want to say barely, I don't like taking high doses of any medications, but it does allow me to function at least throughout my day better. So what happened with the bilateral occipital nerve block, your occiput, I guess, you have two occipital bones back here, which are actually at like the base of your skull. So when they do an occipital nerve block, I'm just gonna get my hair out of the way here, hopefully you can see. The anatomy points for the injections are typically supposed to be somewhere around where your occiput meets like your neck. So somewhere around like right here, because it's bilateral. You don't have to have a bilateral injection done. Hopefully you can still hear me back there. But mine was bilateral, and so it's supposed to be injected here. The physician who did mine did not have much, if any, experience. I learned at a later point, and he actually injected me. I can still feel the huge dents in my head. He injected me all the way up here, right there. Very sensitive. So if you can tell the anatomy, that's not where I was supposed to be injected. That is not where an occipital nerve block goes. Anybody that is looking into getting an occipital nerve block, make sure you go to someone reputable. Even if they are told, even if you're told they are reputable, double check. Ask questions before you have it done. Ask what they're going to inject into you, what steroid specifically, what numbing medicine, how much of this are they injecting, and where are the points, where are they actually going to inject, and ask what you can expect afterwards, the risks, the benefits. I did ask some of these questions. I was too trustworthy. And I did question when he did it why he was going up here, but you think it's ordered by a neurologist. So this person said they know how to do it and that they're legitimate and aware of the anatomy. research, excuse me, research it. Just be sure and research it. I don't want anyone to ever have the experience that I've had with it. So what happened was they injected Kenalog, which can be apparently a kind of normal thing to inject into like epidural steroids and things like that. They used Kenalog 40 on me. I wish I had asked prior, and I honestly wish I chose to never have done it. Let me make that clear. It did not help my headaches. It was ordered for my Chiari malformation headaches that it causes, like the throbbing headaches that they cause, pulsating. And it did not help in any way. I'm not saying that some people don't get relief from it. You may be one of those people. For me, it made everything worse. That's just my experience with it. So they did the Kenalog 40 injections. I have very large dents from steroid atrophy in my skull and scalp. So it damaged all the nerves. Anyone that knows anything about the scalp and head anatomy and all the sensory nerves and cranial nerves that run through there, you can imagine having probably about this much of your scalp tissue. You don't have a lot there. Like, you don't have a lot to cover your scalp. Nobody does. About that much of mine was ate away by the steroid on each side. And it actually continued to spread and eat, atrophy, eat away at the muscles, the tissue, and part of the bone. Not a fun thing. It messed with my vision, especially on this side. And it's just been a process to try to get through and manage. So that's my story. That's why I have trigeminal neuralgia. I'm trying to be as positive as I can about my experience and share this absolutely, because I don't want anyone to ever go through what I went through, and just to be aware of it, that is a possibility and it can be a complication. So just do your research, please, before you have any nerve blocks, but especially any that go near your neck or head, for sure. So those are the reasons for my trigeminal neuralgia. Now let's move on to positive things like treatment for it. I guess I shouldn't say, treatment, management is more like the term I'm looking for. Definitely not curable, but it is manageable. And most people choose to initially, and I'm gonna stick with not doing any surgery, but I'll discuss the surgery that they do for it at the end. The non-surgical options that are by doctors are offered, and what I've been through in my personal experience: heat therapy and ice therapy to the jaw, the face, even the back of the head, like neck, this area. I alternate between both. I typically choose heat, moist heat, like rice bags or the things you can order on the internet that are like heatable in the microwave. Applying those, or even like a moist towel with hot water on it, could work. To the jaw area, any areas where you're having pain, like even up there. So heat works better for me personally. There are times where I will choose ice and alternate, but typically ice and cold aggravate mine worse and cause the shock-like pains even worse. So that's just me. Just play around with it and see what works for you better. Second is medication, and that means like oral medication is what I'm typically going to discuss. And the oral medications that work for managing trigeminal neuralgia, and most, like any neuralgias or nerve pain, are just a few of them, and these are some that I've tried. Gabapentin, Lamictal, which is lamotrigine, and clonazepam. I believe those are the only 3 that I've tried because I could not take Tegretol due to my red blood cell count being high on some of the markers. So Tegretol was not an option for me, but Tegretol is actually one that they prescribe probably first line, to be honest. I was on gabapentin for about 2 years. For me personally, I did not notice a difference at all. It made my dizziness that I already had even worse. When I was going into work, I was constantly dizzy. That's just my experience with it. I know many people it works miracles for. So just ask your doctor, and you may have to try a few before you figure out like what works for you. Depakote is actually another one. There's quite a few. So they're called anticonvulsants if you ever want to do research on that medication class prior to seeing your doctor and discussing medication options for management with them. So, and basically staying out of the cold has been really good for me. Like staying out of like really cold weather, or carrying like a scarf or something to cover my face, my cheeks specifically, if I'm gonna be out in really cold weather. That helps a lot. So just some measures you can do to try to manage it. And if all else fails, if this is something you want to research, I've definitely researched it and called a few doctors, neurosurgeons about it to get their opinions. It's called a microvascular decompression surgery. It is considered minimally invasive, and they go in, I would have to look again, but they go in, I believe, somewhere around this area with, and make small incisions and insert like a scope type instrument or like a small tube-like instrument to be able to go in and cauterize, which means burn. They basically burn off different parts and areas of the trigeminal nerve that is giving the patient problems in an attempt to deaden the nerve. So then nerve signals don't go to the brain, pain signals don't go to the brain the way that they normally would. So it, in hopes, does not hurt so much, if at all. I've read mixed reviews on this, and that's why I personally I'm avoiding any more surgery unless I feel like it is going to be totally beneficial for me. But that may be the route to go for you. There have been many success stories with it. Just do your research. As I've said 100 times, research. Don't obsess about it, but definitely familiarize yourself with things before you go in and make a decision or let a doctor make a decision for you. They're there to guide you, not make the decision for you. So do what is best for you and just stay positive. It's not an easy disorder to deal with, but just do not give up. There are options, and those are some of them. So that is my experience with trigeminal neuralgia. If anyone has any further questions for me, please let me know, subscribe, and I hope everyone has a blessed day. Again, get out and do something fun. Thank you.